Lynette. Hi, my name is Sky.
Hi, Tuesday.
Hi, I'm JD.
Hi, my name is Justine Fernandez and my speech is on COPD. Do you like smoking or like the feeling of what smoking does for you? Have you ever wondered how much smoking can affect your body? Well, today my speech is on COPD, which stands for Chronic Obstructive Pulmonary Disorder. I have chosen this topic specifically because I've watched firsthand every day how this disease can deteriorate somebody's body. My grandmother has had COPD now for almost 10 years. This disease is uncurable. All doctors can do is provide treatments and medications to help you, but your body will never be able to act the way that it was before or even work properly again. As stated by CDC.gov, COPD makes breathing difficult for the 16 million Americans who have this disease. Yes, I said 16 million. Millions and more people are suffering from COPD every day, but have not been diagnosed or been treated. The three most common lung diseases found in COPD is emphysema, chronic bronchitis, and refractory asthma, which means non-reversible asthma. They are a group of diseases that cause airflow blockage and breathing problems. Emphysema is basically damaging of the alveoli, which is, more simpler terms, are air sacs. Pretty much our body has air sacs, and inside the air sacs are walls, and when you have COPD, the walls actually tend to disappear, making the larger sacs become individual small sacs, which leaves the air not being able to flow properly, which is why you can't really breathe that well, stopping the blood from getting enough oxygen. Also, when the alveoli are damaged, the lungs become stretched out and lose their springiness. The airways become flabby and the air is trapped in the lungs. It becomes hard to breathe out, and this is what creates the feeling of shortness of breath, which is said by COPDFoundation.org. Chronic bronchitis has been the most knowledgeable one to me because my grandmother has a serious case of this lung disease. Chronic is a fancy word for a disease that will not go away even if you feel better. Chronic bronchitis is the damage to the bronchial tubes. I don't know if I'm saying that right, but the causes are coughing and shortness of breath. Imagine feeling like you ran a mile and you know that feeling that you start to get out of breath and basically you just start to take slow, deep breaths to get your heart rate back to normal, right? Well, with this, it's a constant feeling of running a mile and never being able to catch your breath. For example, my grandmother has had COPD for almost 10 years now. The first time we started to realize it was when her cough didn't go away for almost 7 months. Mucus would come up every time she coughed. The cough sounded very wet and it tends to hurt your throat because of how much you cough repeatedly. In our bodies, we have hair-like fibers called cilia that are in the tubes of our lungs. The cilia helps move mucus up the tubes so it can be coughed out. In chronic bronchitis, the tubes have lost their cilia. This means it's hard to cough up mucus, which causes more coughing. More coughing makes the tubes more irritated. This creates more mucus. The tubes then become swollen, making it hard to breathe. Smoking even just a little keeps the cilia from working normally. Mucus can build up in the lungs, and this can cause more damage, quoted by COPDFoundation.org. Lastly, there's a lung disease called refractory asthma, which means non-reversible asthma. It's not normal asthma. There's no medication to stop the tightening of airways like other asthma medications do. There's a particular asthma that usually is caused by COPD. Per newtoasthma.com, the rate of refractory asthma increases when the communities adopt to the Western style and get urbanized. Here, in spite of the extensive re-evaluation of the diagnosis and the management over an observation period of nearly 6 months, patients find it difficult to control their severe asthma symptoms. Refractory asthma can be managed by taking the most common oral steroid called prednisone, which is what my grandmother takes. It is a very strong steroid, and the doctors only prescribe it a few pills at a time. The side effects are the worst part, but it only is one of the medications that can keep the attacks to a minimum. As said previously, COPD is a chronic lung disease that tends to kill people, maybe not right away, but eventually. No doctor has figured out a medication to solve this problem. All you can do is take several different medicines to control the disease as much as possible. I try to tell everybody around me not to smoke because you're just killing your body day by day. The feeling of not being able to breathe or having a bad cough is not what you should want for your life. Remember, the feeling after smoking a cigarette is not worth years of feeling sick and never being able to recover properly. Emphysema, refractory asthma, and chronic bronchitis are very effective and damaging to the body, so don't play around and end up with it. Because like my grandmother says, no cigarette is worth this pain.